Mm. Ah, undo. Shoot. Okay. Okay, hi guys. I am going to finish up this this class about caring for the newborn, and we are on. Let's see. It's slide 64, but parent and infant bonding. You can see that. So nurses are responsible for working with parents, and in the hospital, one of the big assessments that we have to do is assessing those attachment behaviors. Are the parents and babies doing the things that they need to do to start that bonding process? Now, you guys know that one of the ways that we do this is skin-to-skin contact immediately. So what are some of the other ways that we look at? We do, parents are looking, gazing into the baby's eyes, baby gazes back, and they cuddle, they point out the features that are the same as family members. They stroke the baby, so touch is a big thing. They think about the baby's welfare. So if they can't be with the baby all the time, they would send the baby back to the nursery if they're doing something else where they couldn't see the baby. And they want to spend time with the baby. So rooming in, we've talked about that before. Rooming in means that the baby is with the mom all the time. And that's basically what we do. What we do now, you know, we don't have a very big nursery. Babies don't get sent to the nursery to be cared for anymore. So they just go in and out and they stay with their parents so that we can assess bonding behaviors and then also encourage bonding behaviors. So educating parents to take care of their babies, critical thing. Remember at the very beginning of the year, we talked about when you foster competence, if parents feel competent in caring for the baby or confident in caring for the baby, they're going to feel competent. They will just take it and run with it. They're going to feel so much better. They won't question everything that they do. So that is an important piece right there. Cultural considerations. One of the things, some countries are very maybe male dominated, or it's not natural for the men to interact with children until they get older. And so there are some ethnic groups, nationalities, where it wouldn't be normal for the dad to be attaching. And so you do need to remember that. Okay. Discharge planning and teaching. you guys know about all of this. All of these things are in or need to be in your notes in your OB packet. And like I said, you need to know them. Non-nutritive sucking is to relax the baby, and for pain, you should familiarize yourself with sudden infant death syndrome. You know about cord care, skin care, so all of that is kind of a review. Car seat safety, we no longer, car seats are a state law, okay? So we don't send patients home without a car seat. We have car seats available for purchase. If they have a car seat, we don't want it to be expired. So there's a 7-year expiration on car seats. And I don't even think we really check to see, because car seats get recalled all the time for some reason. And so so parents are responsible for knowing if their car seat is expired or not. We have, or being recalled or not, and we can help with that. We used to be that there were certain people on the unit that were certified in car seats, and they would go and check the car seat and everything. And now, because of liability, unfortunately, we don't even touch the car seat. We can help the patients adjust the straps or tell them how the strap should be adjusted, but we don't put the infant in the car seat. We don't put the car seat in the base in the car. So car seats have gotten a lot easier, I guess. Signs of illness in the newborn. You guys can see this: difficult feeding, regurgitation, lethargy, hypothermia, crying without cause. Again, all of these things are in your OB packets in the teaching notes. So hopefully you did a nice complete job with those and you are able to study from those, right? Okay, let's see here. Here's where I want to go to this one. My computer is acting very, very strange. Okay. Zoom the slideshow. Wow, that's great. Okay. Huh. Hold on for a sec. My computer is not working. Okay, guys, sorry about that. Gosh darn it. It's just crazy. So, car seat, it's in there. The safest place for the baby is in the back seat and also in the center of the back seat, okay? And we don't turn babies around now for quite a while. I couldn't tell you the exact thing. Let's see. Okay. All right. Going back to crying without cause, I just want to state that, gosh darn it. Okay, here we go. Babies have different cries, and it's very overwhelming. You guys have all seen the Period of Purple Crying videos and the Happiest Baby videos. We don't know why this period of purple crying happens. It just does. It is not the same thing as colic. Colic would be a tummy issue, some spasming in the gut that would give the baby some like gassy intestine, okay? So that can be very overwhelming. We need to be sure to tell parents that if baby is crying and they've tried to feed the baby, they've changed the baby, and they're getting very frustrated, they need to be put in a safe place and so that the parents can step away, maybe call somebody in to take care of the baby, because this is the time when shaken baby happens. So our telling parents about this, really critical thing. Okay, newborn sleep also 20 out of 24 hours, but they should be easily roused, and when they're awake they should have good tone. So okay. And sometimes babies cry because they're overly stimulated, like they totally get passed around when people come to visit. So follow-up care, you guys know that we do immunizations. We do the Hep B immunization. They get another one in the next 2 months. They have a 2-week visit. And then they'll just be coming in for their shots after that. If they have a high bilirubin, they may have to come back in the next day or 2 for a bilirubin check. So that is something. We do not teach cardiopulmonary resuscitation, but we encourage parents to have that. And usually, again, babies die. They go into heart failure, or they need cardiopulmonary resuscitation because they have stopped breathing. Usually it's a respiratory issue that makes the heart stop. So, okay, so it's really good to warn first-time parents, especially, maybe remind other parents that mom needs to not be carrying anything heavier than the baby. She shouldn't be doing abdominal exercises. She shouldn't be vacuuming. And we talked about having heavier flow, and mom needs to relax and watch her bleeding. But again, babies sleep 20 out of 24 days or 24 hours, and we do monitor. Our mom should sleep when the baby sleeps, getting some naps and then also some activity. It's really good at first to possibly have somebody like a grandma to come in and help. Limiting visitors. If I ruled the world, there would be no visitors on OB, only immediate family, because we have so much to teach mom. She's so exhausted and she needs to be resting. So when they get home, they're going to need to rest, especially if they have other children at home. Catch rest as much as they can, ask for help, and then limit visitors. Some people put a sign on the door that says, you know, mom and baby are sleeping, please come back later, because people will just kind of drop in to see the baby. Some of the things I like to remind parents that my cousin did this and I thought it was brilliant. Have a designated sink where visitors need to wash their hands. Keep paper towels there. Where the baby, in the room where the baby is or all around the house, have hand sanitizer, so that people can sanitize their hands before they touch the baby. If you have a smoker, remember third-hand smoke. Don't let anybody who smokes hold the baby up against their clothes because it can affect the baby's respiratory status. You could have like a heavy shirt that visitors could put on if they smoke, so that if they want to hold the baby. Okay, so first, second, and third-hand smoke, all bad for the baby. Development of day-night routines. Sometimes moms will come back and say, oh my God, my baby has his days and nights mixed up. And so, and that can be challenging. Some people really believe in a nighttime routine. And you know, this follows up into toddlerhood and childhood, where we have lower lights, there's not a lot of activity, you rock the baby, cuddle the baby, maybe have some soft music or white noise going, and just to try to get the baby to be awake more during the day instead of during the night, so parents can sleep. Okay. All right, so we talked about crying, long periods of crying most of the time. That's the period of purple crying. Use of quieting techniques. Babies should be able to stop themselves from crying. There should be a little stop every once in a while. But using a pacifier after the first 2 weeks of breastfeeding, or breastfeeding the baby to quiet the baby if they will take the breast, rocking, all of those things that we talk about in Happiest Baby, swaddling the baby nice and tight, doing that shushing noise or white noise works, jiggling the baby a little bit. Some people will put babies on top of the dryer. Car rides are another thing that people will do to relax the baby and help them go to sleep. Okay, and parents should know the developmental milestones when there are growth spurts, when they could expect to have to increase feedings, but usually we pretty much go by what the baby says. And infant stimulation. So they say that babies like black and white. They can see about 12 inches, 7 to 12 inches in front of their face. They definitely like to follow lights. So infant stimulation would be touch, sight, talking to the baby. They definitely recognize their parents' voices. Okay, and you guys know the signs of illness for sure. That's in your OB packet again. Okay, so review. Why is vitamin K given to newborns immediately after birth? So remember, you have to have normal flora to synthesize vitamin K in the gut. Baby's gut is sterile. And so, and the vitamin K stimulates the clotting factors to happen. So it's basically so the baby doesn't bleed to death. What is the medical name for newborn rash? Erythema toxicum. It's a red spot with a little white center. It comes and goes, it travels. Some babies can be covered with it. Most babies have a little of it, about 80%. What would be an intervention the nurse could implement for a newborn with physiologic hyperbilirubinemia? So the nurse wants to really encourage feedings, okay? If a baby has, we have a bili on a baby, we would look at the graph to see what kind of follow-up needs to happen, and then we would implement the lights if the baby's bili is high enough and late enough. The newborn's first bowel movement, called meconium, you guys totally know that. And dude, have a great day. Okay, so that's it. Again, Monday's quiz will just be on the assessment and care of the newborn. All right, peace out.